Hi, I'm Lizzie. I'm a speech and language therapist from Wythenshawe Hospital, and I'm here to talk to you about swallowing difficulties. As a speech and language therapist, we treat issues that result in problems with speech, the sounds that are created by moving your tongue and lips, language, the way spoken language is understood, organised and produced in your brain, voice, the quality of sound produced by the voice, and swallowing, the process of eating and drinking. All these processes involve the larynx, which is commonly known as the voice box. This is a side view of a person's head and neck. On this picture, you can see the tongue, teeth and lips clearly. As you move further down the throat, you can see the epiglottis, which helps protect your airway during eating and drinking by closing the entrance to your airway. The larynx sits behind your thyroid cartilage, known as your Adam's apple, and serves most importantly to protect your lungs and also to produce voice. Inside the larynx is where your vocal cords sit, at the top of your trachea, which is commonly known as your windpipe. Air flows up from the lungs as you breathe out and passes over the vocal cords, which vibrate to make sound. Next to the larynx is your esophagus, your food pipe. When you swallow, a ring of muscle at the top of the esophagus relaxes and food passes down towards your stomach. Dysphagia is a term used to describe problems with eating, drinking and swallowing. Normally we don't give much thought to swallowing. It's something that we do automatically. For example, we swallow about 800 times a day to manage the 2 to 3 pints of saliva or 1.5 litres of saliva that we produce daily. Although we don't think about swallowing, it's a very intricate process and a lot can go wrong. Speech therapists are medical professionals who manage swallowing. Typically, we take a sip of drink or a bite of something solid and we use our tongue, teeth, lips and palate to hold it in place to stop it from escaping from the front of our mouth or down to the back of our throats. We chew solid food and get it soft and smooth enough to move it to the back of our mouths. When we're ready, we move it to the back and down towards the throat. The more solid the food, the more effort required to chew. The thinner the fluid, the faster it moves towards the throat. Our windpipe and our food pipe are very close together. To make sure the food goes into the food pipe and stays away from the airway, a few things happen. We hold our breath by closing our vocal cords. The voice box moves up and forwards, pulling the airway away from the food pipe. This also pulls the epiglottis down like a lid covering the entrance to the airway. The throat muscles then squeeze together to push everything down towards the food pipe. There are lots of conditions that can cause swallowing problems, and the swallow can be affected in many different ways. For example, weakness or incoordination of the muscles, changes to or loss of taste, fatigue, or changes to sensation or the feeling in your throat. Some difficulties have more severe consequences. At its worst, food, drink or saliva can go down the wrong way into the lungs. This is called aspiration and can be very dangerous. Usually, people cough when this happens in an effort to remove food or drink from the airway. We've probably all had this happen to us at some point. But if it happens regularly, it can be harmful. It can cause recurrent chest infections, pneumonia, or in extreme cases, death. Some people with reduced sensation aren't aware when this happens and so don't react. From the outside, it can look as though everything's fine when actually it isn't. Many people with respiratory disorders experience issues with eating, drinking, and swallowing, and this is the same for patients with COVID-19. This is largely due to problems with breathing, trauma to the airway, and general weakness. For swallowing to remain safe, the body must coordinate the breathing cycle with swallowing. If you're not able to hold your breath for long enough while you're eating and drinking, food and drink is at risk of getting into the airway. Breathing in immediately after swallowing increases the risk of food and drink being inhaled into the airway. The swallowing muscles are like any other muscle in the body. If they're weak, they don't work properly. And a weak cough can make it harder for you to be able to eject anything that's entered the airway. If you've been on an intensive care unit and needed a breathing tube, there could be trauma, swelling, or scarring inside the throat or airway. You're then less likely to notice if food or drink goes down the wrong way due to the sensory changes. If you notice any of these common signs of swallowing difficulties or have a chest infection, it's important to contact your GP and a speech and language therapist. Changes to coughing or phlegm, difficulty breathing, a temperature, or new confusion may be signs of a chest infection. There are a few things you can do to make swallowing easier and safer. Make sure you sit upright for all your food and drinks and for 15 minutes after. This is to give yourself a better chance to clear any residue from your throat. Opt for softer, more moist foods. Eat and drink slowly with small amounts at a time. Avoid distractions like TV or talking while eating and drinking. It's important to keep your teeth and mouth clean to reduce the risk of infection, so clean your teeth thoroughly twice a day. Mouth care really does matter. There are also a few exercises that you can do to optimise swallowing. Choose the ones you think you need and do them at least 3 times a day. If you're struggling with drooling, you may need to improve lip strength. Alternate between exaggerated ooh and ee. Additionally, press your lips together and hold. You could use a tissue or piece of paper between your lips and make sure you can keep it there for a count of 10. To improve tongue strength, if chewing is difficult or you have food or drink left over in your mouth, stick your tongue out as far as you can and try to hold it still for a count of 10. Lift your tongue up to your nose for 10. Move it as far left as you can for 10. Then as far right. Practice licking your lips, inside and out. The next one is called a tongue press. Raise your tongue so that it is touching the roof of your mouth, just behind your upper teeth. Keep it there, but open your mouth as much as you can. Push your tongue against the roof of your mouth and create as much pressure as you can. Hold it there for 10 seconds, then relax. After that, press your tongue as hard as you can against the roof of your mouth 10 times in 10 seconds. The effortful swallow is good for overall weakness. Just imagine you're trying to swallow as hard as you can. Think about squeezing the muscles of your throat as you swallow. The Masako improves contact between the back of your tongue and throat. It's a good one to do if you feel it takes a few swallows to get something down, or if you feel food or drink sticking in your throat. Stick your tongue out and place it between your teeth. Try to swallow your saliva while keeping your tongue in that position. If this feels too difficult, instead of swallowing, try to say the word kick. 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 The falsetto improves airway protection by helping the voice box to lift. Make an E sound, then increase the pitch as high as you can until it sounds really squeaky. If you're struggling to swallow or feel these exercises might help, it's really important to contact your speech and language therapist. There are lots of exercises and changes that we can suggest. We've not mentioned them all here because they're not appropriate for everyone and would only be recommended after a thorough speech and language therapy assessment. Your GP and consultants will have details for local speech and language therapists in your area. Thanks for watching.